Hi, this is Orla, speech and language therapist from CATS Ireland, and welcome to Common Terms You May Hear If You or a Loved One Has Been Diagnosed with Dysphagia webinar. If you or your loved one has been diagnosed with dysphagia, this can be a scary and lonely time. You may feel confused, alone, or scared. You may hear lots of new terms that you don't understand, and this can be confusing. We have compiled the meaning of common terms which you may hear to make this journey a little bit easier. Dysphagia. Dysphagia is another word for swallowing problems, and it may develop due to nerve or muscular difficulties. Dysphagia is common, for example, after nerve damage following a stroke. As dysphagia makes it difficult to swallow, patients may become malnourished or dehydrated. They may also develop aspiration pneumonia, which we will discuss in greater detail later. Deglutition is another word for the act of swallowing. A reflex is an involuntary action mediated by the nervous system, for example, the gag reflex. A diagnosis details the nature and cause of a health problem. Prognosis relates to the probable outcome or course of a disease. It can also relate to the probable chance of a patient making a full recovery. Oftentimes, patients with dysphagia require rehabilitation. This helps the patient reach a maximum possible level of independence following an injury. The pharynx is a muscular tube which runs from the back of the nose to the top of the esophagus. It allows air to pass from the trachea to the mouth and nose, and food to pass from the mouth to the esophagus. The larynx is sometimes known as the voice box. The larynx is involved in respiration, production of voice, and swallowing. Vocal folds is another name for the vocal cords. These are located in your larynx. When air is pushed out of your lungs, the vocal folds vibrate and voice is produced. These close during swallowing to prevent food entering the lungs in aspiration. The airway is the path that air takes following from the lungs up through the mouth or the nose. Aspiration occurs when food or fluid accidentally enters the airway instead of the esophagus. This may occur in response to dysphagia and swallowing problems. Aspiration pneumonia can occur following aspiration. This involves inflammation and infection due to food or fluid entering the lungs accidentally. A video fluoroscopy is an X-ray of your swallow. This allows the speech and language therapist to determine the safety of your swallow across a range of foodstuffs. Endoscopy involves a small lighted camera being inserted through the mouth or nose to examine the nasal passage, the pharynx, the laryngeal vestibule, the esophagus, and the stomach in certain incidences. Laryngoscopy is a similar technique to endoscopy. However, the camera may be rigid or flexible. A nasogastric or NG tube is a short-term alternative feeding option. This involves the passing of a feeding tube through the nasal cavity down into the stomach to allow the passage of food. A PEG tube may be inserted as a long-term option for alternative feeding. It is inserted through the skin and sends food directly into the stomach. A gastrostomy is similar to the PEG tube. The esophagus or the food pipe is a passage for food which connects the pharynx and the stomach. The upper esophageal sphincter is a ring of muscle which separates the pharynx and the esophagus. It prevents food coming back into the pharynx as a reflux. Achalasia is a motor disease of the esophagus. This can cause dysphagia and may also cause severe chest pain. It may lead to food regurgitation and can be due to muscle weakness and sphincter difficulties. The lower esophageal sphincter is a ring of muscle which separates the esophagus and the stomach and prevents the advancement of gastric contents into the esophagus. Reflux is the return of stomach contents back into the esophagus. This may cause heartburn or may be silent reflux, causing no overt symptoms but swallowing and voice difficulties. Reflux may also be known as gastroesophageal reflux or laryngopharyngeal reflux. It can cause scarring of the esophagus, and if severe enough, certain patients may require dilatation. Manometry is the gold standard in upper esophageal sphincter and esophageal disorder diagnostic testing. It measures pressure gradients developed within the esophageal body via the production of pressure graphs. Botulinum toxin is the medical name for Botox. Botox is a neurotoxin which disables nerve endings and stops them from releasing chemicals which causes muscles to contract. Botox is used when muscles have excessive tone or spasm. Dilation involves passing of inflatable devices into the esophagus and inflating them to stretch the muscles. This is used when there is excessive tone in muscles. Finally, myotomy is done with lasers or traditional surgery, and it cuts the fibers of the upper esophageal sphincter with a view to reduce tone and mean upper esophageal sphincter pressure, and to allow food to pass into the esophagus easily. You've been watching an online micro course from Cats Ireland. I am Orla Gulhini. You can find out more information on our website www.catsireland.com.